Taking care of kids today is much more difficult than it was 30 years ago. Children have much more complex medical needs, and as a result, taking care of them is harder and requires a different facility and different personnel. Across the country, community hospitals have essentially decided to get out of taking care of children, to stop taking care of children because it is harder. Stamford Health, through the generosity of the Stephen and Alexandra Cohen Foundation, has decided to get more involved in taking care of kids. And what we've done over the last year is build a brand new pediatric emergency department, the only one in Lower Fairfield County, and more recently opened up a brand new pediatric inpatient unit. We can treat children across this spectrum with minor medical needs, with more significant medical needs, in facilities that are state-of-the-art, that were built specifically for them and have considerable support space for them, for their families, and for their parents.
As a hospitalist, we are involved in every critical aspect of the child's care, from admission all the way to their discharge process. And we make sure that we provide care to them, follow up on their treatments, follow up on their lab results, address the parents' needs, and also make sure that the discharge process goes smoothly and seamlessly, and basically deliver them back to their primary providers. When a patient comes to this facility, it's bright, it's clean, it's beautiful, it's well lit. I think the level of stress of the family and the patients naturally decreases a little bit. And that's for me very important to know, because we're not only treating the patient, we're also treating the family and the siblings who come here. I think if a patient had to stay here for more than a day or two, they would feel comfortable in this facility.
We are thrilled to be moving into the Stephen and Alexandra Cohen inpatient unit. It has the same nautical theme that is carried over from the Children's Specialty Center and the Pediatric Emergency Department. Very soothing, very relaxing. During their hospital stay, they can play games and watch movies and really heal. It has a state-of-the-art playroom that has a lot of interactive devices, and it has David's treasure chest, which is really a phenomenal way for patients to experience this unit. In this day and age, when most community hospitals are not putting any resources into pediatrics, we are able to have our department flourish and offer subspecialists, offer this state-of-the-art inpatient unit, have a state-of-the-art NICU, and so many resources to keep children in this community and not have to travel to New York or further away for state-of-the-art care. So that when parents are here and their child is hospitalized, they know that we are giving them the best experience possible.
So as a pediatric surgeon, I am able to evaluate and treat children with a variety of surgical issues that we see in newborns, young infants, children, and even adolescents. I've taken care of 2 premature infants who had inguinal hernias. We see children who have appendicitis. We have children who are traumatized, accidents, falls. Again, no reason to go up 40, 50 miles. That's the sort of thing we can do right here locally. We have an operating room which is brand new. We have rooms which are dedicated to the children. We have dedicated rooms both preoperatively as well as in the recovery room. We have nurses who are trained in dealing with these children. We can give them a comfortable, caring environment and make them and their parents feel like we really care about not only the child's surgical issue, but the entire child, the entire family unit.
Having a pediatric emergency department right here in our own community is really a game changer for this area, because being in an emergency department is stressful both for children and families. There's a lot going on, there's a lot of activity, and some of it can be really intimidating for children. We have 8 separate treatment rooms. Our triage room is separate, as is our waiting room. We have a nice waiting room with the very important fish tank and some things out there for the children to do. We've built a great team here. We have specialized pediatric emergency medicine physicians. So we all did 3 years of pediatric residency, but then we did an additional 3 years of pediatric emergency medicine fellowship. So everyone knows both how to approach a child, but also to handle the more complex cases. So we're able to offer a different level of care. I think it's really reassuring for parents to know that they're getting a specialized level of care from people who really understand the developmental stages of their children and who can take care of both the medical but also the emotional needs of these children.
So what does this all mean for the care of children in the Stamford region? It means that we are taking care of kids that we couldn't take care of a year ago. It means we're taking care of kids in a facility that we didn't have a year ago that's brand new and state-of-the-art. What it really means is that the future of pediatric care at Stamford Health couldn't be any brighter.